What are kind of those numbers out there? Are there facts out there that really counter that mental health and mental health conditions is an issue for our community?
You mentioned that 50% of people with mental health concerns, Asian American, Native Hawaiian, Pacific Islander, 50% don't receive services. Actually, it's higher than that. Only 30% of AA and APIs with mental illness received treatment in 2022.
Wow.
So that means that a very small number in terms of the people who could have or needed services received them. That is very alarming, because what ends up happening is that when people do end up needing, gets critical, right? It's more advanced. So as a community, we're not responding early enough to mental health concerns, and it ends up being very severe when people do get in treatment. So early treatment is really important. The other thing is, it's really important to realize that suicide is the leading cause of death for AA and HPI youth ages 10 through 24.
I mean, that's got to be alarming for parents that are listening in. Asian parents are listening in on this.
Absolutely. I think mental health stigma is such an important thing to consider in our communities, because if we don't start talking about it, we're going to lose children. Is sort of the bottom line, I think. I feel like, we need a lot of things. We need culturally relevant practitioners. We don't have enough of them. We need dominant culture practitioners to have cultural humility. We need to address intergenerational trauma. I mean, so many Asian American communities have had trauma from war, from exclusion acts, from internment camps, ongoing, right? So in addition to the racism faced, say, in COVID, the Chinese flu and all that kind of thing. So, I mean, there's so many things that impact us. And I think, we really need to start talking about it. I just feel like there's such a lack of ability to share even how we're feeling, right? Really.